Blood pressure is the force of blood pushing against the walls of your arteries. It is measured using two numbers: the systolic pressure, which is the top number representing the pressure during a heartbeat, and the diastolic pressure, which is the bottom number representing the pressure between heartbeats. According to current American College of Cardiology and American Heart Association guidelines for adults, blood pressure is categorized as follows. Normal blood pressure is a systolic reading of less than 120 millimeters of mercury and a diastolic reading of less than 80 millimeters of mercury. Elevated blood pressure is a systolic reading between 120 and 129 millimeters of mercury with a diastolic reading less than 80. Hypertension. Stage 1 is a systolic reading between 130 and 139 millimeters of mercury, or a diastolic reading between 80 and 89. Hypertension. Stage 2 is a systolic reading of 140 millimeters of mercury or higher, or a diastolic reading of 90 millimeters of mercury or higher. A hypertensive crisis, which requires immediate medical attention, is a systolic reading greater than 180 millimeters of mercury, or a diastolic reading greater than 120 millimeters of mercury. Several key concepts are important to understand. Hypertension is often called the silent killer because it frequently has no symptoms. Blood pressure is variable, meaning a single high reading is not diagnostic. Diagnosis requires multiple elevated readings over time. White coat hypertension refers to elevated blood pressure that occurs only in a clinical setting. Target goals for treatment are based on individual health. For the general population, the goal is to maintain blood pressure below 130 over 80 millimeters of mercury. For high-risk patients, such as those with diabetes or chronic kidney disease, the goal may be more individualized but is often also below 130 over 80. To get an accurate blood pressure reading, follow these steps. Sit quietly for 5 minutes before the measurement. Avoid caffeine, exercise, or smoking for 30 minutes prior. Ensure your feet are flat on the floor, your back is supported, and your arm is positioned at heart level. Use a validated blood pressure monitor with a properly sized cuff. Non-pharmacological management through lifestyle changes is a cornerstone of treatment. The dietary approaches to stop hypertension, or DASH, diet emphasizes fruits, vegetables, whole grains, and low-fat dairy. Sodium restriction to less than 2,300 milligrams per day, ideally less than 1,500 milligrams, is recommended. Regular exercise of at least 150 minutes of moderate intensity activity per week is advised. Weight loss is recommended for overweight individuals. Alcohol should be consumed in moderation. No more than 1 drink per day for women and no more than 2 drinks per day for men. If you found this video helpful, don't forget to like, share, and subscribe for more informative content. Stay tuned for our next video.